I think we always continue to talk about the difference between home care and home health care because there is a huge difference. But a lot of people, especially when you're first into it with your aging
Sounds
parents,
similar.
you don't really know what the difference is.
So today the focus is on home healthcare, and we are bringing in Stephanie Rice and Kim Hastings from Robinson Creek. Thanks so much for being with us today. It is such a confusing often topic because it sounds so similar, but let's focus on what is home health care.
I'll take that one. Home health care is covered. Well, number one, home health care is covered by your insurance. And it's when somebody has a skilled need. So either they need a skilled nurse to come to the house for something or skilled therapy, physical therapy, occupational therapy, or speech therapy.
And let's talk about what is a skilled need. What can you give us some examples?
Sure. I mean, a skilled need example could be somebody who just had a total knee replacement done and they're going to need assistance in their home. Somebody who's diabetic,
a new diagnosis of diabetes, especially because that way we can teach them on their medications, teach them how to do their diet, checking their blood sugars, when to call their doctor, when they need to go to the hospital. Pretty much that's, for all disease processes out there. And it could be acute issues, or it could even be chronic issues that have had a lot of medication changes.
All of these are medical issues. So because of that, does a doctor have to be involved, and does a doctor have to send you to get home health care?
Correct. We need to have, you need to see your doctor within 30 to 60 days of starting home health care, and your doctor has to write orders for home health care.
So which starts first? You can actually call in home health care first and then go to the doctor, or you have to go to the doctor first to write orders, I guess, or almost a prescription?
You can actually do both. So it's you just need to make sure that you're seeing the doctor for the current reason that you need home health for. We like for patients to see the doctor before they come to us, and we know what we're actually treating them for. Now, in instances where somebody's in the hospital and they go home and they haven't seen their doctor yet, we want them to have that follow-up visit with their physician within that 30 days of coming home from the hospital, but we can start treating them until they see their doctor as well.
Gotcha. Okay. So that's one scenario where, that definitely makes sense, where you just haven't had a chance to see your doctor yet versus going in and saying, hey, you've just been diagnosed with diabetes, where that would probably be something the doctor would take care of first. And then you realize that you need home health.
Yeah.
Yes.
Does insurance pay for this? Do you have to pay for it? How does the doctor decide who pays for it? How does the money work?
It's covered 100% under Medicare. So if somebody has traditional Medicare, then it's covered 100%. There's no responsibility for families. If somebody has United Healthcare or supplemental different insurances or retirement insurances, we just have to run them. Some are covered at 80%, some are covered at 100%, but we by no means send the family a bill for any kind of payment.
Interesting.
Wow.
Now, how long does home health typically last? Is this usually considered sort of a in-between time when somebody gets out of the hospital, or like you mentioned, Kim, when somebody first gets diagnosed with diabetes and needs to understand how to manage that? So is it designed to be kind of a short-term care, or can home health last for a long time?
It can vary depending on what they're on services for. So some can be on a very short time if they've had surgery, they get better, they graduate from home health. But then the ones with the more chronic illnesses, especially if they're having a lot of medication changes or they're in and out of the hospital, then they would be on services much longer.
What are some of those chronic conditions? Just to give us an idea of what, the different, like when we hear diagnoses, we might realize, oh, okay, that might qualify.
It could be heart disease, diabetes could be one of them. There's all kinds.
I think during COVID, we ended up getting a lot of patients from cardiologists for INR checks.
Yes.
That's probably a really good example. Somebody who has to frequently go to the doctors, maybe every week, to get their INR checked. And it's a lot. Yeah.
What is that? What is INR?
It's blood work. And INR is
Okay, got it.
the coagulation of the blood. When
Okay.
you're on certain medication.
Gotcha.
So they have to be checked sometimes a couple of times a week, sometimes it's every other week. It just all depends on the patient. And how the medication works.
And being able to have home health come in keeps them from having to actually go to the doctor's office or to a lab to have that done every week.
Yes.
Correct.
Okay.
And then our other goal is also to keep them out of the hospital. So
Yeah.
our nurses go there, monitor them, and make sure that nothing's going on. And if it is, we contact the doctor to try to catch it before it gets to the point of going to the hospital.
Sure,
Yeah.
sure.
I think my dad had COVID, was in the hospital 3 days last year during the height, I guess you could say, of it. And he had a little home health care right afterwards. I think he wanted it to continue, and the doctor eventually said, nope, Mr. Barnes, you're done.
Mhm.
And I think he was a little bit disappointed. Do you run into that sometimes to where people are like, oh, I wish it would last longer?
A lot.
Yes. Most of them love our nurses coming out.
Yeah.
And they love doing the physical therapy. So it does happen a lot.
So you need to just coordinate with your doctor, I guess, then in that case.
We do. So, for home health care, the RN goes out every 60 days, and there's what's called a reevaluation.
Hmm.
So, and that's when Kim works with her team of nurses to determine, can this patient stay on with us another 60 days or not?
Hmm.
So we look at 60-day intervals right now.
Hmm.
And they kind of go through all the doctor's notes they have, listening to what's going on with the patient. Have they had new medication?
Hmm.
If the patient's stable and nothing really is going on, it's hard to continue them.
Hmm.
So at that point, we will let a family know within a 5-day notice, we're going to be discharging you guys next week.
Hmm. So then I guess, as you mentioned, that's when you graduate, if you will, and until I guess you need it in the future, potentially.
Yes.
Got it. Okay.
Yeah, there's still so much confusion, I think, at least for us, and I think for anybody who's fairly new to taking care of and helping their aging parents. Again, the difference between home care and home health care. Is it a problem if home health care does come out, the doctor says it's okay, you get home health care, and then you start asking for things that are really home care? Is it an insult? Are we doing something wrong? Do we really need to study ahead of time to know what to ask for?
No, I mean, I think that's the number one confusing thing.
Yeah.
And I think for us, we've been in healthcare so long that we have to remember, how we talk to families about what the difference is.
Mhm.
So I think the best way that I like to explain it is that anything that you need non-medical wise, if you need somebody to come out and stay with your family member for a few hours a day,
Mhm.
so you can help them with meals, maybe in and out of the shower,
Cleaning.
house cleaning, taking them to doctor's appointments. That's all covered under, that's all home care.
Mhm.
And that's private pay.
Mhm.
There's long-term care insurance policies that can help supplement.
Mhm.
And also there's state programs through state Medicaid that can help supplement those programs as well.
Mhm.
So there's not a clinical need for
Mhm.
home care, but
Right.
for home health, there's a clinical need.
Mhm.
The patient has to meet certain qualifications to qualify for it. And we don't exchange money with families on that. We directly work with insurance companies.
Gotcha.
We have a lot of patients that do both.
Mhm.
We have a lot of patients that are on home care and home health.
Mhm.
And that's very common.
At the same time,
Correct.
Yeah.
because they need it. Yes.
Right. Because the nurses that are coming, so it's always going to be a nurse that's coming to you when you're in the care of home health.
Home health is always going to be a nurse or a therapist coming to you.
Mhm.
Home care, you have a nurse that goes out generally to do an evaluation, and then you have either certified nursing assistants or just caregivers
Gotcha.
on the need of the family.
Okay. So that's definitely the biggest difference, that when you have home health, you have a nurse or a therapist that's doing the work, if you will. And they're there to do the medical work, not to fix a meal or things like that. That would be home care versus home health. Got it.
Yeah.
Okay.
So when the doctor says it's okay, you do need home health, how do we find someone? Do we just say, okay, I need to go to Robinson Creek, or does the doctor suggest who I go to, or how does that work?
Both. I mean, there's a lot of doctors that like to work with certain providers. So, I always tell families it's good to ask your doctor if they work with anybody or in the doctor's office,
Mhm.
because that's somebody who they already have a rapport with, and that
Mhm.
generally does work.
Yeah.
If they're doctors, like, you guys can go to whoever. Sometimes you guys can just do a Google search and look it up, or you can ask for recommendations.
Mhm.
Most places will give you recommendations of at least 3 companies.
Okay, gotcha. So it is. So I guess it's helpful for families to know that even if a doctor recommends or says, "Hey, this is one that we work with," the family still gets to choose who they bring in for home health.
Correct. Always. It's always the family's choice.
Okay.
So what would we look for? Or what would be things that we should ask when we're making that decision to choose a home health care company?
I think one of the most important things is making sure they have adequate staffing.
Mhm.
So just to make sure that you do service the area that I live in, especially right now with staffing and COVID, there's some areas that we might have that somebody might say like we service Bastrop, but maybe they really don't though. So I would make sure they service your area first.
Mhm.
If you're needing more than nursing and you're needing therapy, I would talk to that home health company and make sure they have physical therapy or occupational therapy.
Okay.
If your doctor is recommending that as well too. I
Mhm.
think those are really important questions to ask to make sure.
Mhm.
And then anything that you're needing them for, like if you know your loved one gets a lot of lab work, make sure the home health company can also draw labs.
Okay.
And those are really simple things that you think they would do, but if you don't ask, you don't know that.
Do you sometimes do portable X-rays and things like that, even as a home health agency?
Portable X-rays, we do labs.
Okay.
Wow.
And we have access to portable X-rays 24 hours.
Okay.
Yeah.
So a lot of services. One question that I have is, how long is a nurse typically going to be there with that aging parent? Because it's not going to be, they're not there all day, right? They come in to do the
Yeah.
job, and I would imagine is wound care also something that gets, I'm just trying to think of all those examples of things that we hear. So
Yeah.
how long would we expect a nurse to be, or a therapist to be with our aging parent?
Generally, it's 30 minutes to 45 minutes,
Mhm.
depending on what the need is. Obviously, if it's wound care, it'd be longer.
Mhm.
Therapists usually about 45 minutes, they're there in the home.
Mhm.
But yeah, normally maybe the initial assessment might be over an hour,
Mhm.
but generally speaking, the nurse isn't in the home
Right.
longer than an hour.
Mhm.
And if they are, it might be a high acuity of care that we're doing. There
Mhm.
might be a lot of medical needs in that home for that patient.
Mhm. Mhm.
And after the nurse is gone, do you get many, I hate to call them emergency calls, but calls from a son or a daughter going, I don't know what to do. Oh no, what happened?
Had a lot.
Yes, and we have somebody on call 24 hours a day, so
Yeah.
Mhm.
we answer the phones and take care of what we can take care of.
Yeah.
Mhm. Yeah, because often the family figures out that they don't know exactly what to do. But I think what you mentioned too is that I think it's important for people to again recognize and understand the difference between home health and
Mhm.
home care. That if you need somebody to be there for hours at a time to be with your loved one, then that is home care. Where
Right.
home health is when a nurse or a therapist is coming in, doing the work, doing the care that they need,
Mhm.
but they're not there just to
Right.
be a companion. I guess that would be the biggest
Right.
difference.
Something more medical.
Yeah, yeah.
Yeah.
Is there anything that we've missed that you think it's helpful for especially adult children to be aware of when it comes to home health care?
What do you think?
I think we covered it all.
I think just
The
knowing
basics
that
anyway.
I mean, it is complicated. And like I said, we've been in it for so long, so it's easy for us when somebody calls us.
Mhm.
But when we have a family member that's in a hospital, I think it's really good to start asking those social workers those questions
Mhm.
about discharge planning for your family member right away. If my mom's in the hospital right now, I work full time, I'm not going to be able to be her caregiver. It's so important to start that process right away when you get to the hospital.
Mhm.
Mhm.
Give those social workers or discharge planners time to go over different services with you. Um, I think home health is so underused, and it's great because it's covered under your insurance.
Mhm.
So, if you have a family member who maybe your mom's not walking like she used to, maybe she's calling you all the time because she doesn't know which medication she took or
Mhm.
things like that. That might be you as the adult child talking to your mom and calling the doctor and saying,
Mhm.
"Hey, can we just get home health to go do an evaluation at the house?"
Yeah.
Mm.
And a lot of doctors appreciate it because they don't know what goes on at home.
Right.
True.
There's
Right.
so many rooms that nurses walk into, and there's pills everywhere,
Mhm. Wow.
tired things or so something as simple as medication management,
Mhm.
we can come in and do, and we
Mhm.
can get it squared away. And also for home health, we can get all those doctors working together along with the adult child,
Mhm.
who's involved, whoever the children are. And I think it really helps paint a better picture of
Mhm.
what's going on with your aging parent.
Yeah.
So definitely a good reminder for us as adult children that the more we can be involved and part of
Mhm.
our parents going to the doctors and getting to know their doctor, so that if we see a concern that our parents might think, oh, it's fine, because they don't want they may not think they need that extra help, for us to be able to potentially talk to the doctor too, to say, hey, I'm seeing some challenges, or I'm seeing some problems, or I'm seeing pills everywhere when I go to visit mom. Maybe we need to try to advocate and bring it up to the doctor that maybe home health would be a good option.
Exactly. And then the other thing you can do too, we get a lot of referrals just from families directly. So
Mhm.
then if they call us and say they really want to use our services, we'll talk to them with the intake process, and then we can reach out to the doctor and request orders and say why the family is requesting us to go in and see mom or dad.
Oh, gotcha. So you can be almost kind of a filter to find out, hey, here's what we're seeing. Do you think this would be something that would qualify?
Yes.
Yes.
Because we have a lot of adult children that don't live in state, maybe they aren't as involved.
Yeah.
But it doesn't mean that you can't call us, and we're more than happy to call your loved one, your family member's doctor's office,
Hmm.
and they send over, a referral to us, and Kim and her team look through it to
Hmm.
make sure clinically there's a reason we can go in there.
Sure. Okay, that's great to
Gotcha.
know. So
Yeah.
you can go through the doctor or even go through the agency directly.
Oh, yeah.
Awesome.
That
That's
is
great
great.
to know.
Stephanie Rice, Kim Hastings, you cleared up a lot of home health confusion. Thank you so much.
Yeah.
Thank you.
Yeah, I love being able just like the very specifics and the examples of what kinds of conditions might be included,
Mhm.
as well as just helping us understand when it's time to make that phone call, whether it's to the agency or to the doctor.
Yeah, and we know firsthand that home health is very important. It really helps your aging parent. If you've got any type of topic you'd like us to discuss, let us know. Parenting aging parents.